Hi, my name is Shia. So just an introduction of myself. I'm currently a third year nursing student who is studying my Bachelor of Nursing degree in Swinburne University of Technology. And also after graduating from my degree, I really want to join a registered nurse graduate program in order to gain more clinical experience and also consolidate my nursing knowledge as well and also clinical skills as I transition from a student nurse to a registered nurse. And I would really like to apply my graduate position in St. Vincent Private Hospital because I was very lucky being able to do my second year acute placement in St. Vincent Private, and I really enjoyed my placement experience there. And as it has really sparked my interest in working in acute care nursing and working in a fast-paced environment. And while I was on placement, the education team in St. Vincent Private has been amazing so far. They have been really helpful, really supportive, and really have helped me to achieve all my learning goals that I want to achieve for that placement. And another reason why I would like to apply my grad year position in St. Vincent Private, because the hospital provides 2 6-month rotation between two different clinical areas, which can allow me to gain more experience and then being able to explore both general ward and specialty unit. So I feel like I could really get a lot of experience working in different clinical units if I can do a grad year there. So that is why the reason why I really want to apply my grad year in St. Vincent Private. So moving on, one of the career exploration that I really want to achieve in my nursing career is not just stop there in my learning and education. I really want to do a postgraduate studies as well to increase my knowledge and also credentials as a nurse. And also because cardiac ward is also one of the nursing area that I really want to specialize in. St. Vincent Private Hospital not only provides cardiac nursing care for their graduate nurse program. However, St. Vincent Private also works with many universities as well, such as ACU and Deakin, to provide postgraduate courses with the specialty in cardiac care. That is why I really want to get to further my studies as well. And also I also get to, through research, I also get to see that St. Vincent Private Hospital has many specialist education consultant which could provide help and support for me as I do my postgraduate studies. That is why I really believe that I will achieve the best clinical practice if I can get the amazing opportunity to join the postgrad program provided by St. Vincent Private in the future. And also, like in 5 to 10 years down the road, another career aspiration of mine is not just staying or working as a bedside nurse. Actually, I really want to get into management position as well, being able to take on more responsibility, different situation and scenarios, something beyond taking care only a set number of patients. As I know that St. Vincent Private Hospital really values providing this development opportunities and trainings to their staff by working with St. Vincent Private Hospital. In the long run, I can really envision and see myself growing as I get more experience working in a hospital and also being able to contribute to guide and train other staff as well in the future. One of the example of a challenge that I faced during my placement, I would say, while I was on my second year of placement. Actually, at the time, while I was giving Klexan injection with my buddy nurse, actually at the time because it was quite a busy ward. So at the time, after other patients from another room buzzes, actually while I was about to give my Klexan, my buddy nurse went away. So at that time, because there wasn't anyone there and I had no supervision or whatsoever. Actually, I didn't give it at first. I waited for her to come back and then after that I gave it. So at that time, when she came back, she wasn't actually too happy about it because it was a busy shift and she wanted me to help her a bit. This and that, and then after that, actually I was really intimidated at first in the first place because she was quite mad at me for not being able to do things efficiently, and I waited for her. At the time, I was just scared. I was really intimidated. I was just quiet, basically. So, but after that, after like giving myself like 15 minutes to 20 minutes to calm down. Actually, how I managed that situation is I actually managed to go up to her and then just had a talk to her. I say, hey, look, so sorry that I wasn't able to give you more help just now, but actually giving medication or even giving injection without any support or without any supervision is really not within my clinical, it's really not within my scope of practice. That is why I'm so sorry, even though we have been giving Clexane the whole morning, actually I cannot do it without you, without any supervision. Actually, just after letting her understanding my perspective, after communication, actually we are all good. So actually I can really get to see how important it is to being able to stand up for yourself, because I feel like as a student nurse, it's really easy to think that whatever you do is wrong, like listening to others. But I can really see that through experience how important it is to understand your own scope of practice and being able to communicate well as well, letting the other nurses or other staff to know your perspective as well. So therefore, through that challenge, even though it was really intimidating for me to go up to her, I have really learned a lot the importance of communication as a nurse. And also moving on, two unique strengths that I can bring to the role. I would say first is I can empathize and I have a compassionate heart towards patients and their family because of my own experience as well. My grandmother was diagnosed with Parkinson's disease a few years ago. So at the time, we went to many hospitals, and then actually at the time, there wasn't any, like we met many nurses and doctors who really couldn't empathize with our situation. Therefore, at that time, it was really a suffocated feeling for myself as a family of a patient. And after that, actually, we finally met a nurse who really can empathize with that situation. And after that, I really can see, I want to become a nurse like this. So actually, I would say for myself, even though as a grad year, as a grad nurse, my competency, skill, and clinical knowledge might not be the best, but through my compassionate hearts and the fact that I can empathize with my patients and their families as well, I can really establish a good therapeutic relationship with them. So and also I understand that compassionate is also one of the 4 core values of St. Vincent Private Health. I really hope that I can bring my compassionate in the workplace as well. So I would say this is one of the first unique strength that I have. So secondly, one of the strength I have is, I would say, being able to adapt to a new environment, because I'm not from Australia. I'm an international student from Malaysia. So actually, I also moved to many places and countries before back then. So actually, I'm able to really adapt well through experience as well to a new environment. As a graduate nurse, or even working with St. Vincent Private, I will be doing rotations and maybe going to different wards. I can really see myself being able to adapt well to different culture, different environments as well, talking to different people of different cultures, being able to connect better to my patients and also their families as well. So I would say that that is one of the strengths that I can really bring into my role. So not being able to manage stress in a new clinical environment as well. So that is one of the 2 strengths that I have that I could contribute to my role. And what is the biggest challenge that I foresee in my first year as a registered nurse? I would say as a graduate nurse, I feel like knowledge gap or lack of experience would be something that would be a challenge that I would face, that I would have to overcome, because I feel like it's really easy going to ward feeling like I don't know anything about this patient, I don't know anything about this situation, because uni and real life work is completely different, like feeling that you don't understand anything, you don't have any experience dealing with certain clinical situation. I feel like first, I need to acknowledge that it's completely normal. As a graduate nurse, I'm not expected to know anything. And also how I would manage that, what is my strategies? Actually, first is recognizing the fact that I might need help and support from others, because I'm also a grad year nurse as well. And one of the strategies that I came up with to deal with this challenge actually is to never stop researching and learning, even after work as well, as learning is always an ongoing process, and being able to recognize and prioritize what is the urgent things that I need to ask my educator or ask other nurses, and what is the thing that I can research after work, what is the knowledge gap that I want to learn more, that I want to know more as well. If I cannot find the answer, or if it's really urgent, actually I feel like I wanted to, how I would overcome this challenge is not being afraid to ask help from nursing educators as well, which is why I really hope to get to work with St. Vincent Hospital, because it provides such great education support and advice, and actually acknowledging the fact that everyone learns at a different pace, everyone has different learning objectives as well. So I feel like this would be how I would manage my challenge or my fear of not having enough knowledge. So this will be the end of my video grad assignments. Thank you so much for your time to listen. See you. Thank you.